Hi everyone, welcome back to my YouTube channel, and today we are going to talk about pulp stones. So let's start our topic with introduction. Pulp stone, also known as denticle, are discrete calcified masses that occur within the dental pulp. May be found in coronal or radicular pulp, and their size, number, or distribution vary among the individuals. Although often asymptomatic and discovered incidentally on radiograph, pulp stone hold clinical importance in restorative and endodontic procedures, especially because they obstruct canal access. Definition of dental pulp stones. Pulp stone is a calcified structure found within the pulp chamber or root canal, either free within the pulp tissue or attached to dentine walls. The calcification can be microscopic or large enough to occupy significant pulp space. Etiology of pulp stone. First is age-related changes. As with advancing age, pulp undergo fibrosis and decreased cellularity that make it more susceptible to calcification. Second, etiology is long-standing irritation, as chronic pulp inflammation due to caries, deep restoration, or trauma can stimulate calcification. Third etiology is genetic predisposition, as some individuals may be more prone to pulp stones formation due to hereditary factors. Fourth etiology is local factors, as mechanical irritation such as tooth wear, orthodontic movement, or microtrauma. And fifth is systemic association, as certain systemic diseases show an important prevalence of pulp stones, including cardiovascular disease, endocrine disorders, and genetic diseases like dentine dysplasia or dentinogenesis imperfecta. Classification of pulp stone. Based on structure and based on location, they are classified. Based on structure, there are true pulp stone and false pulp stone. True pulp stone composed of tubular dentine and they are formed by odontoblasts or odontoblast-like cells. They are rare compared to false pulp stone. False pulp stone do not resemble dentine structurally. They are formed by calcification around degenerating pulp cells, collagen fibers, or thrombi. They are more common than true pulp stones. Then there are classification of pulp stone based on their location. Then on the basis of there are free pulp stone, attached pulp stone, and embedded pulp stone. Free pulp stone are located entirely within the pulp tissue. They are not attached to dentine wall. Attached pulp stone are attached to the walls of pulp chamber or root canal. Embedded pulp stone incorporated within dentine due to continuous dentine formation. They are formed when the secondary dentine surrounds the calcified mass. Morphology and characteristics of pulp stone. Their shape and size can be round, oval, or irregular or nodular. They range from microscopic granules to large masses filling the pulp chamber. The number of the pulp stone. They may occur as single or multiple stone. Their prevalence increases with age. Composition of pulp stone. They are made of calcium phosphate crystal. In true pulp stones, the composition resembles dentine. Pathogenesis of pulp stone. Calcification around degenerating tissue. First, there is as necrotic cells, collagen fibers, and blood vessel remnants are present there. They can become nuclei for calcification. And then second starts odontoblast activity, as trauma or irritation may stimulate odontoblast like cells to deposit dentine like material. And third is strep, there is muscular thrombi calcification. There are blood vessel thrombi in the pulp that can mineralize, forming concentric calcified masses. Clinical features of dental pulp. They are usually asymptomatic, as pulp stones do not usually cause pain or discomfort. They may affect pulse sensitivity tests, as the large stone can alter response to vitality testing. They are associated with dental restoration, as pulp stones are more common in teeth with extensive restorations. Radiographic appearance of pulp stone. Coronal pulp stone appear as small, round, or oval radiopaque masses within the pulp chamber. Radicular pulp stones appear as less visible due to superimposition of surrounding structure. They appear as small opacity within the canals. Limitations of radiographic appearance. They appear very small. Pulp stone may not be radiographically detectable, so they may miss from the radiograph. Histological features of the pulp stone. First, there are two pulp stones that show dentinal tubules are linked by odontoblast-like cells. Then there are false pulp stones. They have concentric lamella resembling onion layers, and there is no tubular structure present there. Clinical significance of pulp stone. Endodontic challenges. Pulp stone can obstruct canal orifices, making access difficult, and it can cause deviation of instrument or block canal negotiation. Pulp stone can cause difficulty in root canal treatment, as they may require ultrasonic instrument for removal. Calcified canal increase treatment time and complexity. Third significance is restorative implications, as large pulp stone reduce pulp chamber influencing cavity design. For significance is diagnostic relevance. Presence of multiple pulse stones may suggest systemic disorders. Management of pulse stones. First, there may be no treatment needed, as asymptomatic pulse stones usually require no direct intervention. Second is removal during endodontics, as if obstruction, canal causes, excesses, ultrasonic tips, and magnification may not be used for removal. For third, the management include prevention, as good oral hygiene and minimizing pulp irritation reduce risk of calcification. Conclusion of this lecture video. Pulp stones are calcified structure formed within the pulp chamber or root canals. Although usually asymptomatic, they hold significant clinical importance in endodontics due to their potential to obstruct access and complicate root canal procedures. They can be true or false, free or embedded, and their occurrence increase with age, irritation, and certain systemic condition. Understanding their formation, types, and clinical implication is crucial for effective diagnosis and management in dental practice. And this is all about dental stone, pulp stone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.